House of Representatives has lamented the poor state of the healthcare delivery system in the Federal Capital Territory and called on the federal government to declare a state of emergency in the sector. The House of Representatives has called for an urgent intervention to address the cholera outbreak in the Zongo community in the Semi district, that is Badagry West Local Council Development Area of Lagos State. Good day, listeners. Welcome to DDM Health News Update today on our program, Your Health, Your Wealth. For remind you guys to subscribe to our YouTube channel, that is Diaspora Digital Media, to get the latest on health. So listen to what we have today. Oral health experts have warned that teeth whitening treatments are unsuitable for everyone, especially children and pregnant women, citing health concerns. Teeth whitening. They also listed breastfeeding women and people with certain dental conditions as those for whom teeth whitening treatments are not suitable, not at all. The experts explained that though teeth whitening treatments are popular for improving dental aesthetics, they may predispose the people mentioned above to some health complications, that is the child and the mother. An associate professor of orthodontics at the Lagos State University College of Medicine, Dr. Tulolase Yemitan, said teeth whitening procedures can pose risks to specific groups and should only be done under professional supervision. According to Yemitan, children under the age of 16 should not undergo teeth whitening because their teeth are still developing and more vulnerable to damage. Yes, they might not even have developed the main molars. The pulp chamber in young teeth is larger than in adults. Yes, and whitening treatment could cause pulp irritation. That is for the children. Also speaking, Yemitan, who is a consultant orthodontist at the Lagos State University Teaching Hospital, also advised against teeth whitening for pregnant and breastfeeding women, citing potential risks to developing fetus and infants. Teeth whitening is not recommended during pregnancy or breastfeeding due to potential risks to the developing baby. That means it can affect your baby, be it the one you're breastfeeding or the one you have in your stomach. Yemitan also noted that people with gum disease, tooth decay, or exposed roots may experience worsened symptoms if they attempt whitening without first treating underlying dental issues. Untreated gum disease or tooth decay can be exacerbated by whitening treatments, potentially causing irritation or pain. This is a warning given by the dentist. In addition, she said people with allergies, particularly to peroxide, a common ingredient in whitening agents, or with sensitive teeth, should avoid the procedure entirely. Note, entirely avoid it. Similarly, the consultant explained that individuals with multiple dental restorations, such as crowns or veneers, may not get the desired results, as whitening agents do not affect artificial surfaces. Whitening will not change the color of fillings, crowns, or veneers, and could lead to an uneven appearance, Yemitan warned. She further explained that certain types of discoloration caused by medications like tetracycline or excessive fluoride exposure may not respond well to whitening treatments. On his part, a dentist, Dr. Adebiyi Farok, stressed that while teeth whitening is generally safe for many adults, it is not a one-size-fits-all procedure. I repeat, it is not a one-size-fits-all procedure. So don't think maybe it works for this person, I should go do so. Your health matters. He said, teeth whitening is not for everyone, just like I said earlier. People with high tooth sensitivity, enamel erosion, or gum disease should stay away from it unless cleared by a dentist. Yes. He added that individuals with multiple restorations may be disappointed with the result. Maybe the reverse will be the case because whitening treatment do not work on artificial teeth, as results may be patchy or uneven. Take note, please. However, Farag said that for healthy adults without underlying dental conditions, teeth whitening can be done safely if supervised by a dental professional. If not supervised, don't think you get a good result. And your health determines. So that is why the dentist has to come in this aspect. However, for most healthier adults rather, whitening can be done safely when supervised by a professional. Like I said, by a professional. So please don't forget. Next, the House of Representatives has lamented the poor state of the healthcare delivery system in the Federal Capital Territory and called on the federal government to declare a state of emergency in the sector. This is as the lawmakers called for an urgent upgrade of healthcare infrastructure and the recruitment of medical personnel to avert a breakdown of the health system in the FCT. This was a sequel to the adoption of a motion moved by the member representing Ndokwa East, Ndokwa West, Ukwani Federal Constituency, Delta State. That is Mr. Nnamdi Ezichi, highlighting the growing strain on government hospitals and medical facilities across the FCT. He said, the population of the FCT has surged significantly over the past 2 decades, while many of the existing government hospitals were constructed several years ago with little or no expansion to match the growing demand. SDG further lamented that the dire situation where critically ill patients are often left unattended or forced to wait for hours due to a lack of available beds and limited facility capacity. So sad indeed. This has resulted to the daily loss of lives that could have been saved. You can imagine. He also decried the insufficient number of doctors, nurses, and other healthcare workers, stressing that this shortage has severely impacted the quality of care and increased the workload of the few available staff. You can imagine, almost all the doctors and nurses has flew away. If immediate interventions are not made, the healthcare crisis may escalate to unmanageable levels, undermining the right of health and threatening the well-being of residents in the nation's capital. You can imagine. Well, the lawmaker, in its resolutions, the House called on the federal government to declare a state of emergency in the FCT health sector and release emergency funds for facility upgrades, personnel recruitment, and the acquisition of vital medical equipment. It also urged the Federal Ministry of Health and the FCT administration to assess the current state of healthcare facilities and identify areas in need of urgent upgrade and resource allocation. The House also resolved to constitute an ad hoc committee to investigate the healthcare situation in the FCT and submit a report within 4 weeks. Furthermore, the House encouraged the FCTA to collaborate with private sector stakeholders and international health organizations to enhance capacity in the short term, while pursuing for the development of a long-term healthcare infrastructure plan tailored to the growing population to the FCT. Wow. We look forward to that. Furthermore, the House of Representatives has called for an urgent intervention to address the cholera outbreak in the Zongo community in the Semi district, that is Badagry West Local Council Development Area of Lagos State. This followed the consideration and adoption of a motion of urgent public importance during Wednesday plenary, sponsored by Lagos lawmaker, that is Ceci Wegan. Speaking on the substance of the motion, Reagan lamented the rising death toll, particularly among women and children who have been exposed to contaminated water sources due to years of poor sanitation and lack of functional healthcare facilities. The heart-wrenching reality is that our people are dying because they lack access to clean water, medical care, and even electricity to power essential health systems. Yes, whereby there is no electricity, how do you think they can store some certain things? Well, according to the lawmaker, the situation has been exacerbated by a 4-year long power outrage in the community, which has crippled water supply systems, vaccine storage, and medical services. You can imagine 4 good years without electricity. How would they store their vaccines? How would they supply their water? How do you think they can be healthy? Hmm. This crisis has been further worsened by the relocation of the Nigerian Air Force Mother and Child Care Hospital, which previously served as a vital health facility in the area. Wow. The lawmaker warned that failure to urgently intervene could lead to the spread of the waterborne disease beyond the shores of Lagos, saying, if we continue to ignore this crisis, we become complicit in the possible spread of this deadly disease across Nigeria. Oh my goodness. He also condemned that what he described as a violation of Section 14(2)(b) of the 1999 Constitution, which mandates the government to emphasize the welfare and security of Nigerian citizens wherever they are. Following the adoption of the motion, the House urged the Federal Ministry of Health and the Nigeria Center for Disease Control to deploy surveillance teams, medical supplies, and launch public health awareness campaign in Badagry West. It also called on the Federal Ministry of Humanitarian Affairs, Disaster Management, and Social Development to coordinate the immediate delivery of clean water, sanitation equipment, and other relief materials. Please, they should do as quick as possible, because the House also directed the National Emergency Management Agency to provide affected residents with water purification tablets, disinfectants, and sanitary kits. Furthermore, the House mandated the Federal Ministry of Power and the Rural Electrification Agency to urgently restore electricity in Badagry West LOCDA to support essential services. This is just as it mandated its committees on healthcare services, power, rural electrification, and emergency preparedness to visit the affected areas, assess the situation, and report back within 3 weeks for further legislative action. Finally, the officials of the Lagos Waste Management Authority and Lagos State Environmental Sanitation Corps have arrested a man, Ogunbadeju Olawale, seen dumping waste on the roadside in the Alapere area of the state. The State Commissioner of Environment and Water Resources, that is Tokumbo Wahab, disclosed this in a statement on his X handle on Wednesday. Tokumbo said Olawale was arrested after being caught red-handed dumping refuse illegally in public. Oh my goodness. He said the arrest followed credible surveillance and tip-offs from concerned members of the community. He said, this is part of our continuous efforts to enforce environmental laws and keep Lagos clean. So please, if you're Lagosians, try to keep your environment clean. The suspect, however, was caught in the act and he will be prosecuted according to the state's environmental regulations. He described the act as a clear violation that undermines its mission of creating a cleaner, safer, and more livable Lagos. The arrest is a strong reminder that we are serious about stopping illegal dumping. Residents must know that there are consequences of environmental abuse, he added. Like I said, try to keep your environment clean. He also praised the role of the public in supporting the state's cleanliness drive. He said, "Dear Lagosians, your support and vigilance are the backbone of our success so far. Together, we are building a city that will not only be resilient and sustainable, but one that our children will be proud of to inherit." Wow. The commissioner reassured residents that enforcement will continue along with community engagement and public awareness efforts. Our goal remains a cleaner Lagos, and we will not relent to that, he added. That is beautiful. Like I said, if you're Lagosians, try to keep your environment clean because cleanliness is next to godliness. So try to be clean often. And your health matters in this aspect because your health is your wealth. Well, with this, we come to the end of today's program on your health, your wealth. Don't forget to like, share, comment, and subscribe to our YouTube channel. That is Diaspora Digital Media to get the latest on health. Until I come up your way next time, I am Nenya Michaeline Izini. Thanks for watching. Do have a wonderful day ahead. Bye for now.